Good morning, and thank you very much for joining us. I am Yori Falani, and hope you had a great weekend. My guest this morning is Dr. Tuyi Mebawondu, public health expert. And unfortunately, well, it's the time. We always meet when we're going to talk about COVID-19 and actions against it.
Other important issues
in public
health. I only discuss health.
Yes.
Politics, I don't know. Any other thing, I don't know.
But talking about, look, the figures that are coming out say since March, something like 3,900, just slightly under 4 million people that are eligible reportedly have been vaccinated, you know. And when I was looking at it, I said, 4 million. I thought the Pfizer vaccine was 5 million, but the explanation is that 2.5 million people, rough figure, 2.5 million people have been vaccinated of the first dose, and 1.4 million people have received the second dose of the vaccine. But in terms of coverage, it's negligible when you look at the entire population. Now, we thought that the phase 2 vaccinations would commence tomorrow, but then a notice from the office of the Secretary to the Federal Government said that it's been postponed. No reason has been given for the postponement, but that event supposed to be happening tomorrow has been postponed. Now, no reason was given. So all I can ask is that, well, as a scientist, and knowing how urgent it is, that they wouldn't lightly postpone what is urgent, what would you guess could be possible causes?
Mostly logistics. I mean, it's as simple as that. Let's appreciate the difference between the first vaccine, AstraZeneca vaccine, and the Moderna vaccine. The AstraZeneca vaccine is 2 doses.
That's right.
And then storage, ordinary fridge, can take that kind of storage. But the Moderna vaccines, ultra cold temperature, minus 20 degrees, once you take it out of the fridge, it can only stay for 12 hours. You must give it within 12 hours. Now, if you look at Nigeria, and I try to really, rethink the logistic constraints, to move the vaccines around most of the parts of Nigeria that may need it, because you cannot exclude a state and give to another state. Mm-hmm. If you've not perfected your cold chain, if you've not perfected your logistics, then it becomes a challenge for you to take that vaccine from the storage and go and waste it. The vaccine has become such an essential commodity.
Indeed.
That, whatever we have to maximally utilize. And the beauty of the Moderna is that it's just a single dose.
It's a single dose vaccine.
Unlike the one that is 2 doses. So, I suspect logistics. Because the vaccines are here already. We had an initial plan that is going to be rolled out from today. But unfortunately, the postponement can only come when the logistics are to be tidied. And then we may not also divorce the ongoing National Association of Resident Doctor strike, from the rollout of the vaccine, because anyhow you look at it, some of them will have roles to play in the deployment of the vaccines. But if they're on strike, you have to. I probably were thinking that they're between them and government will have, call a meeting to resolve some of those knotty issues and find a way to cancel the strike, as it is. But that is ongoing. So if you have not tidied your logistics, either in terms of human resources, either in terms of the storage of the vaccines and proper application of those vaccines, it won't be wise to just go and waste those precious materials.
Well, figures, and I don't have them exactly to hand, but what I wanted to say is that this Delta variant, cases seem to be rising. Cases of COVID, infection seem to be rising, and it is thought that because the Delta variant is much more virulent, we are told, than whatever the first one was called, this accounts for cases rising. So to have a matter of the numbers rising of those who have been infected, and when you combine that, with our attitude, because I want to go there. This is your area, public health. Over the weekend, many of our viewers would, no doubt, if they weren't involved in social gatherings themselves, they are very much aware of people who were. Now, I wanted to make the point that it looks like we've gently returned to normal. That is, to the way life was before COVID-19. And we seem to be very lucky in this neck of the woods, in this part of the world, because you find that when you watch international news, you see that they're taking it a lot differently abroad from what we are doing. So this whole matter, you try to talk to people, and you find people have this notion, I can call it a fallacy, that COVID is a big man affair. Can you please let us be in peace? I don't have any problem with COVID because I am not rich, I am not a big man, I don't live in Lekki, or whatever the indices for big man would appear to be. Have you heard this as well, Doctor?
We hear all sorts, and then at our own level, we try to make, bring clarity to some of those negative narrations. Let me just, as a support to what you've just itemized now, I went to one of the A hotels, what we call about the best hotels in Lagos over the weekend. And to visit a guest, I have my face mask on. We entered the hotel, the guest came down and forgot his face mask upstairs. I said, okay, please, can I get one from the reception? They said, we don't have. We're shocked. That how can you, as an institution that we look up to, that's okay, you are the best, about the best hotel.
About a 5-star or 4 or 5-star
hotel. That's the 4-star in Lagos, in VI. You don't have face masks to give to people that are coming. And normally, you should have been the one to insist that if you need to move around, and not seated in this hotel, your face mask must be on. But they don't even have one. Those people there are not even wearing face masks. So it's very pervasive. The negligence, the lackadaisical attitude is very pervasive. And then we can't then consistently run a society based on, oh, it is not my portion. No, God is protecting us. You can't.
Which he is doing. Nobody's arguing that. But to now shunt scientific evidence aside.
Ogayori, just first of all, don't bring God's narration into the discussion for now. You know why?
You brought it in.
You know why? Because in reality, you cannot claim to be loved by God more than, say, Egyptian or Israelite or American soldiers or those people, or even Vatican City that had to go through that thing. So the factor that is protecting you may be in the biology, maybe in some other things which you do not know. Okay? Mystifying everything that we don't have explanation for is not a way to go for any serious society. Yes, God is, but we can't then throw ourselves in the laps of God, when for those things that we can do by ourselves. So, I had come here severally and I've insisted that since it is difficult for us to monitor and affirm those non-pharmaceutical protocols in the nation, it's better for us to find vaccines by any means and deploy same. So that what we are now going to get is that we'll be free from the severe form of the disease. And then we can be able to have some little interaction, and then the country will not be locked down again.
Exactly.
So that's the way we are, because if you go everywhere, people that are supposed to know, they think they are superhuman. Good luck to them. They are.
When you look around, Doctor, it is a fact that Nigeria has not come down with COVID-19 the way it was initially thought would be the case, because we were modeling ourselves, if no more, than just looking at the world around us, looking at highly developed countries, looking at America, looking at UK, looking at Germany, looking at France. And when we see what was going there, Nigerians sort of battened down, bracing for the worst. And then they found out that after some very unfortunate cases in the beginning, it seemed to have petered out, and therefore people have relaxed. I don't know. I don't know. You said it, that, look, taking the vaccine will ensure taking the vaccine is not going to make you immune to catching COVID. No. but you will be a lot less sick. That's the point that people seem to need to know, that you will be a lot less sick than if you had not had the vaccine. And so the survivability, probability of that goes really up. In spite of that, people are saying, don't worry about the vaccine. I'm good. But it's not a Nigerian problem. Even in America, they are complaining. Americans are complaining.
Yes,
the authorities, they are complaining.
And like I said, the doubters will always be with us. You know, no matter how you do it, people will wake up. Some people, for whatever reason, they will doubt you. Even if you are, you say, okay, I'm sharing 1 million to people. You know, some people, there will be that kind of doubt first. For whatever reason, you know, even if you say that, take this, all your problems will disappear, there will still be doubts. Okay? The doubters are always with us. The doubters are. So, the point is to re-emphasize role of every section of the society in education, in support, and in actually trying to push in the narrative to the majority of the people. Because the Gaussian curve holds true for everything, you know. 95% of people will fall in. There's 2.5 here, 2.5 on this side, the extremes on those sides. So for us is to hold the 95% and try to extend the confidence interval to -1, and +1 on the other side, and try to. So again, if you are trying to go far and use your energy too much on those people that will perpetually doubt, it's not worth it. So what you do is that focus on those people that can listen, act at the institutional and local level. Because, for instance, I don't see an hotel that takes international people coming in here and there, not insisting on face masks, especially in their lobby. I don't understand.
Yet you see
so, and I also don't see instance where we have a structured market, you know, maybe like some of those multi-distance stores.
The malls?
Yeah, the malls insisting on a face, even from the gate. And I don't see any reason why government establishment that needs to take a lot of people not insisting on that face mask while you are in that premise. Or even we can extend that to even our market, general market, where somebody look around and say, put on face mask. But if that is not happening, what then is that for us to engage at the level of, you know, some of those influencers, your mosque, your church, you know, your local group have influence over you. And then if that one fails, then individual. And then we'll see what is possible.
It's so much so, what you just said, Doctor. Well, take Ikeja City Mall in Lagos, here, southwest of the country, where we're broadcasting from. They do what you've said. They will not let you in if you don't have a mask, and they take your temperature. Yeah, that's fine. But as soon as people get in, some people are wearing the mask under the chin as they approach the security gates. I have noticed that the security people will stop them and say, please wear your mask properly. Yeah, so that is fine. But as soon as they get into the mall, down comes the mask. And so you find a lot of people in the mall that use the
chin mask.
It then becomes a chin mask as opposed to a face mask. True, that mask can be inconvenient to wear. But we're talking here about the difference between a mild inconvenience and landing up in critical care in the hospital. But let me take Reverend Dominic. Good morning, sir. Thank you for calling in. Yeah.
Good morning.
Thank you for calling, Reverend.
Good morning to your doctor in the studio.
Reverend gentleman, good morning.
Now, every time we discuss about this COVID, a hand is pointed at most of us who are religious leaders, the pastors. But I've shouting myself blue and black. I believe there's COVID. And it's not a wise for a Christian to say, I won't take vaccine or I won't have it. It's not wisdom. But the issue is this. Everywhere in the world, citizens can have attitude. What puts citizens in the right path is the government. I've said it before. By today, we are not tested up to 4 million people. A nation of 200 million people. Ghana has passed over 10 to 20. They are less than 60 million. What the government is doing? The problem of COVID or not COVID is Nigerian government. Number two, you're telling me a nation in the world that will allow their doctors to go on strike now. Just mention a nation in the world at that critical time that will allow the doctors who are front runners, who are fighting this COVID with all their lives to go on strike. And I heard the Minister of Labour indicate that the reason you will not pay them because they not giving 14 days quick notice. You're a journalist, a senior one for that matter. Do you take a camera to this man and ask him, if they have given you 14 days notice, would you have met all their needs in 14 days? This not have been there 2-3 years ago. You know, this doctor neglect. And the minister saying the reason they will not go because they didn't give him notice. In the same society, sorry to use that word, do you need your medical doctors to go on strike, especially at this time?
Yeah.
So whether there's COVID or not, it has become business in this nation.
Mm-hmm.
But if it's not business, we are stuck with the seriousness it deserves. Thank you, Nigeria. God will bless this nation.
Indeed.
Thank you for the opportunity.
Amen, Reverend Dominic. Thank you very much. The point that the Reverend raises, that sense of emergency that we're in, the Reverend and I imagine more than a few people are wondering, look, we need all the professional hands that we can get in this kind of a situation. Why are we not bending over backwards if that is the way government wants to see it? Why are we not bending over backwards for these doctors? What are they asking for? But I know I can just hear Minister Ngige saying it's a lot more complex than that. But look, the people that you Reverend Ngige, you Dr. Ngige are serving and all the other people, that's not the way they're seeing it. They just see a doctor as a specialist that you can't do. This is not something you can just hire any youth corper to come and do. Why don't you see what you can do for them? But it is what it is. We were going to talk about that today, but unfortunately the Secretary of NAD, he dropped out. We would have heard from him, but we know what it is. They are not relenting. The doctors say, we're not going back. You know, if you won't. So it's like it's a log jam right now. But so we'll limit ourselves to sort of educating ourselves on COVID-19, the vaccination, and as soon as we can get hold of that other conversation with the relevant people. Dr. Mebawondu could talk about it, but you see, that's a different thing.
Of course, I can talk about it because, again, we must put things in perspective.
Let me quickly take this call, sir. Who is on the line? Good morning, Mr. Yakub.
Chief Jolly, sorry. Good morning, sir.
Thank you for calling.
Dr. Mebawondu, good morning, sir.
Good morning, Oga Yakub.
Thank you, sir. Chief Jolly, you see, I want to ask Dr. Mebawondu one question. My question is this, because you see, last week, if I don't make a mistake, we discussed about this Moderna vaccine, which I says that day that anytime they deploy it, I'm ready to go there, because I've been go there, they say there's no vaccine, but I was happy when Nigeria got that 4,000 or 4 million dose.
Yes.
That at least
I
will get at least 2 out of it, and then I am planning to go and take. But this morning or yesterday, the information got in that we are read on social media was that there is something happened to it. I don't really know. I want to know what is really happened to that Moderna vaccine. If they deploy it, finally, are we be able to? Can we go and take it, Dr. Mebawondu? That is the first question, sir. The second question is this: Reverend Dominic said something that Nigerian government allow our doctor to go on strike. Why wouldn't they allow them to go on strike? The issue is this, Chief Jolly, some of our political gladiators and the leader in this country, they have already taken the 2 jabs of AstraZeneca vaccine. I think they believe that nothing concerns them again with due respect to them. In fact, I will not even respect them, because a sincere government will not allow its doctor to go on strike when we are in pandemic. Because the reason is this, they believe that their family, even them and their relatives, they have already taken the 2 jabs of AstraZeneca vaccine. Anything can happen to any one of us. That is why, because they are not saying that, how could you allow your doctor to go on strike? And then these people are not go on strike because of salary alone. Chief Jolly, go to our hospital, you see there's no bed, there's no anything to work for. Even if they don't go on strike, these doctors, they don't have something to work on. Why are they doing like this to us? We fought for this government, we campaign for this government. This is not what we want from them. They should go into negotiation tables with them and then settle them once and for all. How could you be promising a doctor that you are going to do this, you are going to do that? At the end of the day, you turn the round table and then you are looking as if nothing happened. Good man, I got back to two of you and Dr. Mebawondu. Please attend to my questions. Thank you and good morning.
Thank you very much, Yakub. Always passionate about things Nigeria.
Yeah, that's good. Let me just appreciate Reverend, the gentleman
Reverend Dominic.
Dominic and Yakub.
Mr. Yakub.
Because again, Reverend Dominic has told us that he's going to take the vaccine, and even Yakub. Let me address the first part of your question, Yakub. The fact is that if the vaccine is not certified fit, nobody will administer it unto you. Take that, at least at that level, because
and that's the job of NAFDAC.
Yes, NAFDAC has said that they're going to look through the vaccine. If they're satisfied with what they are given, they will not say, go and give to Nigerians. So at least put that trust at that level. So it's not that bad, okay? Once they say the vaccine is good to be given to you, please go take it, okay?
But we can say that the news that we have is that no reason has been given from the office of the secretary.
Yes. For me, I feel it's most likely to be logistics.
Yes.
Nothing nothing more than that, because the vaccine will not leave the country of departure if not fit.
If it hasn't gone through their own testing, quality control.
It's for us now to look at it.
All of that. Let me quickly bring in Chidi, who has called in meanwhile. Chidi in Kafanchan. Good morning, sir.
Good morning, Chief Yori.
Good to have you on.
Good morning to our guests.
Good morning.
Good morning.
Chidi.
Yes, I want to show my passion about the well-being of Nigerian citizens, both the young and the elderly as well. Talking about this Moderna variant of vaccine, I want the experts, particularly the Nigerian doctors that are currently on strike, to advise the people, that is the citizens that are meant to consume this very vaccine. In as much as I know, if the original one that Nigerians are used to, and get to this very new one. If the reactions or the side effects are not going to cause more harm than good, then it is okay. Then I equally want to advise the Ministry of Labor and Employment not to be too stringent in their measures. Let there be talk in a way that they and the doctors that are currently on strike should resolve the issues, and they should go back to the hospitals. Because I want to understand that these vaccines cannot be reached except from the regulated hospitals. Let us do things that will help us.
Well, thank you very much, Chidi, for calling in on that. At this stage, let me say good morning to Dr. Madeli Boyo, who has also joined us via Skype. So good morning to you, Doctor.
Good morning. Okay. Good morning, Dr. Yori.
Did you say something there?
It's
Dr.
just Yori.
It's just Yori.
You have become an expert of COVID.
PhD, okay, Doctor. Well, good to have you, but thank you. Because it looks like your monitor was above your head, but you know, here we are down here. So I've asked what Dr. Mebawondu thinks might be the reason for postponing tomorrow's day as the takeoff for the phase 2 of our vaccination campaign against the backdrop of the authorities saying, the office of the secretary to the government saying that, no reason was given, just that it has been postponed from tomorrow. And so we're asking you to take an educated guess as to why. We've been waiting for it. Now they've postponed it, but have not given us a reason. What do you think might be the cause?
Yes, the ways of government are past finding out, so you can guess. One of them could be the analysis of where to deploy, how much to deploy to different places. Two, there have been very, very poor levels of education and mass mobilization towards this vaccine. The way it is now, even this third phase has not been properly, unlike this first and second phases, are not been properly articulated. Most people still are not convinced that COVID is in town. So the government may want to increase its awareness and then strategically position this vaccine, because now Lagos and Abuja were the main places that we initially used the first and second the AstraZeneca for, and then other states got theirs. But Lagos and Abuja, Lagos was epicenter. I guess they have issues with trying to define. You get to Kogi State, for instance, I say there's no COVID. So I think they are working out something in the background, and they must be trying to get their calculations right. And don't forget, Moderna also has a temperature issue of preservation, then distribution. So I think they have issues that they cannot tell us now. Let's just have faith in them that they are doing a good job, because the most important thing here is government doesn't want to take out this thing, distribute them, and then get some of them never utilized, and they now expire in their hands. So the government was waiting and thinking of which they could have done anyway before even buying the vaccine or ordering the vaccine and bringing it to the country. Apparently, I think they are working on the calculations and also the deployment process. But I may be wrong, just an educated guess.
Exactly. That's your best guess. You'll be surprised how it's almost like a carbon copy with what Dr. Mebawondu also suggested, that look, in the absence of them saying anything, it's going to be along those lines. And of course, NAFDAC is also going to be involved. So since, as long as we're guessing, we can also throw in that, NAFDAC will have to, give it a tick before they can indeed move forward. But Dr. Boyo, we were talking before you came on about cases heightening because of the Delta variant, and yet you see a situation where our own attitude to the imminent danger of COVID-19 is sort of going down. We're taking things a lot easier, a lot more casual. Parties are back the way they used to be. Even when they will announce on the invitation that COVID regulations will be strictly followed, you then expect that maybe you see a seating arrangement, for example, where there are 2 meters or 6 feet between every 2 people. It's not happening. I don't know. The churches too. I don't know how doable it is to put 6 feet between 2 people. We've seen halls, but I don't know if everybody can do that. So we're gently returning to the way we used to be before we heard about COVID at all. Is this a big danger?
Yes, it is. We have let our guards down, and before you blame the public, we start from the educated people, the government. We still conduct party primaries with COVID, and we still go about the place, without masks. So you can look at the last APC primaries and the last local government election in Lagos. It was something else. I think there was nothing like COVID in town. And so people cannot believe you when you are not leading by example. Now, want churches and mosques to keep social distancing, but we don't want market to do that. We are not enforcing it in markets, we're not enforcing it in bus stops. Buses are still carrying full load, and markets are still carrying. Bikes are still carrying 3 people on the bike, even when they sell 1 person. The kekes are still going on. So why can't we deal with the ones we can deal with now? Why go to church and mosques? Why don't we start don't do party primaries without carrying out COVID protocols? Don't go about in markets. You can organize markets under a local government. You can organize markets and say these markets will open from this time to this time, or if they open, please keep strictly to COVID-19 protocols. You can organize even buses. Buses do not carry more than this. When people see that, then they keep social distancing. But the problem is that we're not doing that anymore. And then they're still going on with party primaries all over the country. Party conventions are coming, and then we're not doing anything. So we need to start. Charity should begin from home. This time should begin with government. And we should start it with things that we can control: buses, markets, and party meetings, conventions, and primaries.
Yeah. Okay, one moment. Mazi Okorafo, good morning, sir, and thank you for holding on. Go ahead, please.
Good morning, sir. Good morning, Dr. Boyo, doctor in the studio.
Yeah.
Good morning.
Dr. Boyo, I want to find out from you. This Atlas and the Moderna vaccine we are talking about this morning, What does it take us? Because if you check or take statistics and research work, you know that all these vaccines didn't last up to 8 months in terms of production. What is happening with Nigeria's own, our own vaccine? We have been saying that NAFDAC will cross-check, Ministry of this will cross-check at the end. At the end of the day, we don't know what is happening, because the earlier we get it, the better for no matter how many we import into Nigeria, it cannot go around. And you have seen what's happening now. Our doctors are already on strike, which is not healthy. Now, do you know how many people that have died in Nigeria today as I'm talking right now? Because our doctors are strike, and those that were in oxygen, and those who that were to be taking their drips every 6 hours. What do we do? Because I'm just going on the federal government of Nigeria and the governors in all the states to make sure our doctors go back to work within 48 hours. Because many people have we voted them into the office and they enter, they sit down and remove the ladder. Well, that ladder they remove, they know that they will still come back and see me people.
Okay, Mazi, thank you very much.
Thank you very much. Have a pleasant day.
Thank you very much, Mazi. Okay, Dr. Boyo.
Yes. The first thing is, when he was asking about what other people got the vaccine ready in 8 months, the point of the Nigerian vaccine is going to be a very long road, because we do not have the basics. Most of these countries have been ready and producing vaccines in the last 20, 50 years on the days of smallpox. Our country had stopped producing vaccines for a long time. The vaccine, the virus research institute in Bonn, is almost matters. They are trying to sustain these things. You can't build on nothing. The government had not invested in medical science for a long time. They've only been paying salaries. We don't have any hospital in Nigeria in a center of excellence. If not, our president will not go abroad. So we are already in trouble when it comes to medical facilities. Now, talking about Moderna coming in, it is true. This is not the time for NAFDAC to be testing them. The samples ought to have come in before, and we should have tested them before and done all. That's why I said it's not because of NAFDAC and Standard Organization of Nigeria per se. Those things, you don't open all the vaccines to test. You pick some and you look at the quality, the standard of the temperature, how it is kept, and things like that. You look at the cold chain, how you pass from Abuja to the state capital to local government areas. Those are the things that NAFDAC we're interested in. So I think there's a problem with logistics. There's a problem likely with distribution patterns, and there's a problem with galvanizing the people to respond.
Okay.
Because if you bring the vaccines to Lagos today, people will not go because they do not believe this thing exists. It takes knowledge, attitude, and practice for who to perform these things. So the government has a long way to go in mobilizing people. What is vaccine? Masks. Masks are a form of vaccine. You have your mask, you have your social distancing, you have washing your hands. You are not doing that. You are going for vaccine. If
all right, Doctor.
Enough to put on masks,
Doctor, can I interrupt you for a moment, please? I'm sorry to do so, but okay, we'll take a break now, but stay with us, please, because we'll be right back. Okay, welcome back, and we still are with Dr. Amadele Boyo and Dr. Tuyi Mebawondu in our studio, and we're looking at, well, I don't know if it's a sense of disappointment that the second phase of COVID vaccinations, this time would have been different. It's not the Pfizer one, it's the Moderna one. It's a single dose as opposed to the double dose that we all went through. Well, very many, precious few of us, quite frankly, when you put it in perspective, that was a 2-dose thing separated by, a couple of weeks, that kind of a thing. But now this one is a single dose, and that's been postponed, and the doctors have been preferring, options as to what might have been the cause. But we're also now looking at, one, the seriousness of the vaccine, of the virus, that's known as Delta, and it has been found in Nigeria, and the relaxing attitudes of our people. I hear there's someone on the line. Who's on the line? Good morning.
Hello, good morning.
Good morning. Thank you for calling. I'm sorry I don't know your name, but good morning.
Good morning. My name is Blessing, calling from Ogba.
Oh, great. Thank you very much for calling in. Go ahead, please.
So my question is this. One key issue that has been raised for the postponement of the distribution has been linked to storage facilities. So in 2 parts, should Nigeria receive vaccines that we do not have facilities to store? 1, 2, if these vaccines are being stored, are being distributed, and at some point, the refrigerators in hospitals to keep them or preserve them are also available, how do the public know that this thing is no longer good or safe for us to take? Like the very first doctor talked about, he said there's no point distributing these vaccines and then going to just wasting them. But if they are being distributed and then it's being realized that these things are no longer preserved or well preserved, but then we still need to take it to the public. How do the public know? Are you able to hold public health officials accountable or government accountable to ensure that the vaccines that we're receiving are well preserved?
Thank you very much.
Question.
Thank you very much for those questions. Dr. Mebawondu.
Simply put, I think I know there's a lot of distrust between the public and the government in a way, but we shouldn't extend it to this type of intervention. First and foremost, no public health structure will administer and expire vaccines on you, the vaccine that is not potent. They know the implication. Nobody will do that. They will not also administer onto you a vaccine that has not been certified good by NAFDAC or WHO. Nobody will do that. They are usually monitor, for those vaccines to test the temperature and their potency. Usually in the container, you will see a kind of monitor that will show that the temperature is still okay, either by showing green, So there are measures put in place to ensure that at any point in time, you don't get a vaccine that has questionable potency. And then
what you just said reminds me of some some car batteries where there's a little window there. So just looking at it, you can know the condition of the battery, if it's good or if it's not good. So something similar.
Yes, and then the ultra-cold temperature for the Moderna vaccine actually pre-packed and arranged from the country of dispatch, which is the United States of America, before it gets to Nigeria. So we also know that once you take the vaccine out of the refrigerator, more than 12 hours, it will lose its potency. So nobody in reality, just let us be reassured. And then this speaks volumes to the fact that government is not engaging people, educating people enough so that they can earn a bit of trust in this regard. Because once there's a trust deficit, once there's inappropriate information inadequate information, inappropriate information being dispatched to the people, misinformation will happen.
Okay.
And it will become disinformation.
Okay. So, Blessing, you heard it. It's not going to happen. No Nigerian doctor is going to administer an expired vaccine or a bad vaccine. It's just is not
Nobody will do
going
that.
to happen. Bobby in Jalingo, Taraba State. Good morning, sir.
Yeah, good morning, Okoyori.
Yes, sir. Go ahead, please.
And to your doctor in the studio. Okoyori, what do you expect if a country like Nigeria, that we have some of the best doctors in the world, are going on strike when we have such kind of a dangerous pandemic? Now, the problem is we have the resources. We have the resources, but our problem in this country is leadership and the will. For God's sake, I was listening to the Minister of last 2 days.
Minister of Labour.
On channel. The man is talking as if Nigeria belongs to his company. And unfortunately, this man is a doctor. It baffles me. I don't know. We just need to keep pushing and keep praying for the leaders of this country. This thing is ravaging like more than before. COVID is real. The government needs to take a decisive, drastic action to handle the situation. You don't allow your doctors to go on strike in such kind of situation, for God's sake.
Okay.
It doesn't work.
Okay. Thank you very much for calling in, Bobby. Appreciate your call. Dr. Boyo, that question that Blessing posed, as Dr. Mebawondu has said, that he's aware that there is a trust deficit between us and government, but this is different. The medical profession is different. Would you like to add to that you can't take that distrust into the medical world?
I would like to that. There's this thing called the cold chain I mentioned. Everywhere this vaccine is given, the vaccine arrives in a very well-prepared package. So there are about 6 steps where it gets to the ward where you give the injection. It comes from maybe US, Abuja, Lagos, Ikeja. It goes to local government quarter. From there, they're like ballot boxes, you know. When it arrives there, it will be sealed. It's very cold. The fridge doesn't have to come again. There are chemicals there to keep the vaccine at the right temperature. So what I'm saying now is that people shouldn't be worried about that. And 2, these vaccines are being imported directly from the manufacturers.
Okay.
We're not passing through third parties, and so these vaccines are safe. But regarding the strike or a doctor, there's going to be a big blow, because when doctors, residents in particular, are not available, you find out that there's going to be a workforce deficit. And the nurses that are giving these vaccines in local government headquarters will not be able to, most of them be used in the comprehensive health centers to fill in the gaps for the doctors.
Okay.
So I don't know. This could be the reasons why we are stalling. But I think the government should please look at what the doctors are asking for and meet yourself.
See what they can do about that. Yemi in Akure, thank you for holding on. Good morning, sir.
Yes, good morning, sir.
Okay. Please go ahead.
Yeah, I want to mention 2 major things. Number 1, when the doctor was talking the other time that people are not collecting vaccines, people are not educated, I think quite a number of people are waiting for the vaccine. A lot of people want to collect the vaccine. So that is not, you cannot just, of course, there are a lot of non-educated people that are not interested, but a lot of people are waiting for the vaccine,
okay,
monitoring when it's going to be
okay,
given.
Yes.
Then number 2, I would
continue, please. Continue, please. Yemi in Akure. Well, the point Yemi was making is that whereas there might be those, doubters, he's also making the point that there are a lot of people that do want the vaccine, and that is a truth.
Yes.
But that doesn't remove the fact that there are still many doubters.
And the fact that if many people are ready to receive the vaccine, we must also up our communication to them that, guys, the vaccine is coming.
Yes,
be ready.
yes.
You might have this kind of reaction. We must take that kind of basic information to them to allay their fears and then be able to convert. There are people that are hesitant. There are people that are vaccine reviews that will refuse the vaccine, whatever you say, but they are still hesitant, that looking which way should I go. So the information will help to draw more people into the vaccine receiver pool, and then we cannot honestly sit down and talk about deployment of these vaccines without talking about the current issue going on, whether the Secretary General of the NAD is on set or not on set. We must be able to look and balance these things in terms of the doctors on strike and the comments of the Minister of Labour and all the comments going on.
Exactly.
Yeah, because essentially what is happening, beyond the issue of saying that these doctors are not, we shouldn't take strike to the critical health sector, there are issues, regime after regime. The deficit, the trust deficit is widening every time, it's increasing. If you sign agreements, if you're a government and you sign an agreement, your word should be law. If you sign an agreement, honor it. If you cannot honor an agreement, don't sign.
Well,
don't
exactly.
sign. That is the key issue.
We'll be able to address that.
That is the key issue.
Exactly.
And then the point is that you cannot talk of critical number of doctors or health workers in a nation without talking about educational institution. This guy must be trained in a university or a higher institutions that are perpetually on strike. So we can't just start running things in silos. But honestly, if we don't fix education and we don't fix health, we're still a huge joker.
But at least you have cleared. It's a very good question that Blessing brought up. Say, I'm just an ordinary person. This is because of me. How do I know that this vaccine is good? And both you and Dr. Boyo have explained that no worries on that score at all. Those that do get the vaccines will get a good vaccine. But the point that both you doctors have also made is that government could do a lot more in terms of engaging with the people about it. I have someone calling in. Roslyn, good morning, Roslyn, in the UK.
Yeah, good morning, Uncle Yori. How are you?
Good morning, ma'am. I'm good. Thank you very much for calling in.
Yeah, I just want to comment on the issue that is going on, especially the doctors.
Sure.
Yeah, to be honest with you, our leaders are not doing anything good in that country, and it's very saddening. And I listened to the Labour Minister, I can't remember
Dr. Chris
precisely his
Ngige.
name.
Dr. Chris Ngige.
The man doesn't know what he's doing.
Oh, dear.
The way he addressed Nigeria is not the way to address workers. If you want to calm the tension, that is not the way to talk. He's not talking to his children at all. So he should try and have that ethic of talking to the workers that are in tension. Look at the so-called president is in this country attending to his health.
Wait a minute.
So
Roslyn, you breached a protocol there. The president, not so-called president, the president.
Yes.
The president. Sorry about that, Roslyn, but you sound like a Nigerian, so we would just expect you to.
Even if you're not a Nigerian.
Even if you're not a Nigerian, when you just said what you just said, you really got our backup. We respect our president here. You too, I'm sure you do. But maybe it was just a figure of speech, but it wasn't an acceptable figure of speech. The president is in the UK, yeah. He's there on medical business, among other things, yes. People have seized on that and are commenting on that. Again, yes, but it is the president always, not the so-called president. Now, this whole question about Roslyn took us to the president. Let me stay with the president. In other countries, we see the presidents there being front and center, in this whole campaign about persuading you. Sometimes it depends on, I know different strokes for different folks. You see, if it's some leader of some country will have his whole retinue of experts, and he will brief us, tell us, appeal to us. I'm imagining that I'm over there, and then when there are specific questions, hand it over to the director of this, hand it over to clinical research fellow over there. And so in that sense, you see a lot of leaders, at the forefront of the campaign. Well, we aren't that lucky. Mr. President has not been at the head of any particular COVID, engagement initiative. It's left to the, maybe secretary to the government and incident commander in Lagos, Governor Sanwo-Olu. Those ones are doing an excellent job. But we haven't had our president grab the microphone and begin to talk to us that you need the vaccine and so on and so forth. Alaji is on the phone? Alaji?
Yes.
Alaji Baku?
Yes.
Alaji Uba, good morning, sir.
Good morning, Uncle Yori.
Yes, sir. Please go ahead.
Uncle Yori, about this strike, our doctors are always on the strike.
Yes.
Actually, it's not fair they are not fair to us, we Nigerians.
Okay, the doctors are not fair to we Nigerians.
They are not fair to Nigerians because any small issue they go on strike.
Has Nigeria been fair? Excuse me, sir. Has Nigeria been fair to those doctors?
Yes, they are fair because most of them they go to school under our expenses. They have school. They are going to study their law under our expenses, and they are not fair to us.
Okay. So that's what you wanted to say. The doctors are not being fair. They're withdrawing their specialist, knowledge. They're withdrawing it, and so that's not fair. I guess that's what you're saying. Well, thank you very much.
So if you go to our hospital today, you find what our doctors are doing. They will just sit down for small hours, and they refer you to their hospital.
Okay. So you think the doctors? What you're saying is that the doctors should have been. I don't know, would you use the word more considerate? Unless, okay, I think Alaji has gone. But Alaji phoned in to complain that the doctors are not doing us well at all.
Again, honestly.
I think Alaji's attitude is,
no,
you're still there.
Yeah. No, I don't want to talk to him, Dr. Boyo.
Alaji, are you still with us?
Yes, because, the key thing is that he has made a complaint. That's a perspective. And we have to actually look at the whole spectrum in reality. Because the honest opinion is that, one, you don't have sufficient doctors in this country. Secondly, you know, they are overused.
But I think Alhaji is saying that we have given the doctors much in this country. That's his perspective. We've given them much in this country.
I worked in a public hospital for 21 years before I left. So, you know, I am in a position to be able to talk both at the public level and the private level. I'm in a position, I worked and I left public hospital. That was about 10 years ago when I left the public hospital. And I worked there for 21 years before leaving. So I've given substantial part of my time to serving the public space as far as health is concerned. I deeply understand the challenges and issues confronting both the hospital management and even those people, those doctors and workers, including nurses in the hospital. Now, the critical thing we need to rethink is, one, how do we rethink the compensation mechanism for health workers in such a way that it will avert this recurrent strike?
You know,
secondly,
I'm going to have to stop you there,
how
sir.
do we rethink the management structure of our public health institutions? So those are the two key things. It's not about being fair or not being fair.
Okay, I wanted to bring it also, this question that Alhaji Uba also brought up to Dr. Boyo. Dr. Boyo, your comment on, you know, Alhaji's comment that the doctors are not being fair to us. And when I asked him, are we being fair to the doctors? He says, yes, we've given them much. We've given them much. They should sort of understand us. That's his perspective.
It's correct. It's
very
briefly,
sir.
In this country, and we virtually paid nothing for tuition. So the government has invested in every doctor in this country by giving us what you can call free university education. We paid for accommodation. In my time, we didn't pay for food. We paid for accommodation and food. But the tuition was free, and I think it's still the same. But that does not mean now that we should not pay them their salaries.
It doesn't. And I'm going to have to leave it there, doctor. I beg your pardon. It's so rude of me, but I'm going to have to leave it there because I don't have the time anymore. But thank you very, very much, Dr. Boyo, for coming on. And also thank you very much, Dr. Mebawondu. You know, and also thank you at home. I got to rush off now. I'll see you tomorrow, God willing, for a fresh edition of the program. I'm Yori Falarin. Bye-bye for now.